Derm, pathology, pigmented skin disorders. All right, so for pigmented skin disorders, the first thing I want you to know is albinism. Albinism is normal melanocyte number, but they have an overall decrease in melanin production, okay? And the reason behind that is because they have a decrease in tyrosinase activity, okay? Very important to know. You have a normal amount of melanocytes, but it's because those melanocytes cannot produce melanin via a decrease in tyrosinase activity, okay? Very important. You have to know that, right? That's albinism. That's something they will ask about. Next is melasma. Melasma is just like it's known as the mask of pregnancy. So you get hyperpigmentation, usually around the face, when you are pregnant, and this is known as melasma, all right? If you see that, it's nothing to worry about. It will resolve, okay? Not high yield. Next is vitiligo. Vitiligo is irregular patches of complete depigmentation. And what they want you to know is that it's an autoimmune process that causes destruction of melanocytes. Okay, so it's associated with other autoimmune disorders, and it causes autoimmune disorder that destroys melanocytes. Now, what they want you to know is that it's easier to see in patients that have increased levels of melanin, right? Or melanin, I should say, sorry. Patients that have increased melanin and skin pigmentation, it's easier to see vitiligo on them. But patients who are whiter, that have less amount of melanin, it's harder to see. So what they might present the patient as is a white person that goes out and they tan, and after tanning, they still see untanned spots. That's a way that they could try to hide it in a question stem, which is kind of irritating. All right. Lastly is seborrheic dermatitis. Seborrheic dermatitis isn't a pigmented skin disorder, but it's kind of on its own. This is going to be kind of erythematous, well-demarcated plaques with greasy yellow scales. Greasy yellow scales is high yield, okay? And it's going to be associated in regions of like the scalp, the face, and the periocular regions, okay? So if you see greasy yellow scales, like usually on the face, that are erythematous and well-demarcated, it's going to be seborrheic dermatitis. Now, something that they want you to know about this is that you'll probably see it in association with patients that have Parkinson's disease, which is very odd, okay? Very odd, but that's what they want you to know, okay? It's essentially, it will look like dandruff on their skin, okay? And it's associated with Parkinson's, seborrheic dermatitis, relatively lower yield compared to the others.